The Saturday before I left Nassau Hospital to come home to England, 4 young teenage boys were brought in, all of whom had been shot in the testicles.
Oh,
just
come
the
on
testicles. Nowhere else. I was called to the operating theatre by one of my Gaza and surgical colleagues he had a 12-year-old boy on the operating table. And he'd been shot. It had gone through his aorta. He was dying. He was bleeding. They couldn't stop the bleeding. So they asked for my help. I went in there. I couldn't stop it either, by which time his clotting had all gone wrong. This happens in severe injuries. So he was bleeding out from everywhere, and he died on the operating table under our hands. Awful. I mean, you can imagine, 12-year-old. And his family told us, who'd come with him, that he had been sent by... These were all starving. They're all very weak. So the young teenage boys are the ones who are sent out because they're the strongest to get the food. And he'd been shot by an Israeli soldier there.
Why?
And they'd witnessed this. Well, I can't speculate any better than anyone else as to why this is happening. What I can do is I can document what I saw, and I can document what I heard from, and it was a similar story from all the victims' families, from those that survived, from the victims themselves, from Gazan healthcare workers who went to these food sites in order to get food for their families. They all described the same things, how these young teenage boys were being shot by Israeli soldiers. They had noticed in the ER how there were different body parts being targeted on different days at the Gaza Humanitarian Foundation food distribution points. And other emergency room doctors and nurses I knew corroborated this, that 19 young teenage boys had all come in one day, all of whom had been shot in the head and neck. Nowhere else, just the head and neck. Another day, they came in predominantly with chest injuries. Another day, they came in predominantly with abdominal gunshot wounds. And we noticed this. I started speaking to my fellow surgeons in the operating theatres, and we all noticed this pattern as well. On one day, the Saturday before I left Nassau Hospital to come home to England, 4 young teenage boys were brought in, all of whom had been shot in the testicles.
Oh,
just
come
the
on
testicles. Nowhere else. And the pattern of injuries that we all witnessed was so striking that it was clearly beyond coincidental. And it seemed to us like there was a game of target practice.
And these were all children who'd been shot, Palestinians who'd been shot at Gaza Humanitarian Foundation food distribution sites.
Absolutely. And I operate on a lot of them. I also saw victims, young women who had been shot whilst in their tents in Al-Mawasi, quadcopters hovering over the tents, spraying bullets indiscriminately onto the tents. So I had one woman who was 3 months pregnant, who came in with a gunshot wound in her abdomen. I operated on. We saved her life. The baby survived as well, but the bullet had missed her pregnant uterus by about 2 or 3 centimeters. We saw many examples of that. I saw them on my first trip in December 2023. We saw in Al-Aqsa, we had victims coming in from quadcopter
What
shooting.
did you think of all of this?
I could not believe what I was hearing. I didn't believe a lot of it early on, to be honest with you, Tucker. I was naive, but I saw so much on all these trips. I saw so much clear evidence of children and women being targeted that I believe all of it. There was an episode about 18 months ago, I think, in Al-Nasser Pediatric Hospital in Gaza City, I think about 18 months ago, when the Israeli military invaded the hospital, kicked out all the local staff, and there were 6 neonates left in the incubators when they were kicked out. And they said, there are 6 babies there, and they were assured they'd be fine. The Israeli military left after 2 or 3 weeks, and the doctors, some of whom I knew, went back in there, and those 6 babies were there in the incubators, dead, their bodies rotting.
Oh, come on now.
And there are many other